Thank you once again for joining us. We will begin the session shortly. Good morning, good evening, good afternoon all. Once again, a very warm welcome on behalf of MYT. We very much look forward to supporting you with day 2 of the second annual Health Campaign Effectiveness Coalition meeting, the promise of collaborative action. We would like to open with a few housekeeping notes before handing over to Dr. Deb McFarland, who is moderating session I, on economic aspects of campaigns and integration. Please be aware that the sessions will be recorded. You will be able to view the recordings post-event via the Health Campaign Effectiveness Coalition website. Once again, we would like to encourage you to use the social media channels to promote and engage a wide audience with this event by tagging @HCE Coalition and using the hashtag collaborative action. You have entered the session with your video and audio off. We would appreciate if you could keep your audio muted during the session and help keep background noise to a minimum. If you're invited to speak during the session, please unmute yourself, and please feel free to turn on your video. As this session will be a discussion, we would value your engagement. Please put your camera on and change your view to gallery view for the best experience. We are keen to encourage interaction throughout today's session. Please put your questions in the chat. Please include the name of the speaker that you would like to direct your questions to. During the discussion, the raise hand feature is available on the reactions tab at the bottom of your screen. Please use this, and the group facilitator will invite you to speak. We will aim to hear from as many of you as possible during the session. Finally, the MYT team are here to help you with any technical difficulties. Please use the chat facility on Zoom or email the team at events@myt.uk.com. I am now delighted to hand over to Debs to welcome you to the session.
Thank you all for joining us today for this session that we have billed as economic aspects of integration or for integration, and particularly thinking about economic aspects, as the title says, of campaigns, but also how those campaigns and activities that we're all engaged in fit into the larger portfolio of health system strengthening and, in fact, universal health coverage. So there are many ways that economics plays a role, both as a discipline and as a methodology for looking at economic aspects of what we have billed as campaigns and integration. We hope, as Ross said, that this session will be highly interactive, and we've set it up that way. So we don't have presentations, but we are going to have two people, Alan and Laura, who are going to set the stage for us with some questions, comments, and then I hope lead us into a fruitful discussion. Alan, Dr. Alan Hinman is, is at the Task Force for Global Health after a long and distinguished career at CDC, Emory, and probably other places that I just simply don't know about, Alan, with most of your work over 40 plus years being in immunization strategies and thinking about the integration of immunization, vaccine delivery with primary health care in places and many countries around the world. He's been working on polio eradication for many years. So Alan has a great wealth of experience, both practically from a policy point of view and a programmatic point of view, to bring to us to this discussion. So thanks for joining us, Alan. Laura Bonstapel is a new member to me, although we have gotten to know each other over the last months. who's working with ThinkWell, consulting firm, and as a health economist, and has also a distinguished career, again, that I don't know a great deal about, but I know that she's a wise and thoughtful person. Laura has been working with her team on integration, costing of integration strategies for NTD strategies, and I think others as well, in Sierra Leone, Nigeria, and perhaps other countries. And she's going to share some of that, although not, again, in a formal presentation, but rather with some, we hope, provocative or interesting questions that will start our discussion. Laura, again, thank you for joining us. Again, for those of you who are joining us just now, we hope that this session will be highly interactive. We'll go as long as we have interesting and important things to say to each other, and we hope to the broader community. So Alan and Laura will each make some opening comments about whether economics as a discipline, and economic evaluation as a methodology can contribute or do contribute to framing key programmatic policy and research questions. I think that's our intent, is to try to pose some questions and perhaps some responses from those of you in the audience about the key role or the role that economics can play in our deliberations. Economics sometimes gets a bad rap. That is that economists are those people who know the cost of everything and the value of nothing. That's often a comment that is made. We hope this session will go some way to allay that impression that economics can contribute rather than distract from the work that those of you who are in programs, those of you in policy positions can contribute to your work rather than detract from it. So all of the discussions that are going on in many countries, virtually all countries, about health system strengthening, about universal health coverage, have, at least as one of their disciplinary core, the discipline of economics. And certainly that's the case for integration of NTDs, immunizations, malaria, all the work that all of you are doing. So economics is one discipline. Sometimes in certain fora, it takes the dominant position, for example, at the World Bank. If you're engaged in negotiations or anything with the World Bank, sometimes it can take the dominant position and you feel like economics is the only topic, or economics is the only discipline that has a role to play in these deliberations. Clearly, it is not the only one, but clearly it is important. So we will turn to economics as one of those disciplines that can contribute to the policy and programmatic dialogue, and not the only one. So with that as a jump start, let me turn to Dr. Hinman and ask you, Alan, to make some comments to get our brains going at whatever time of the day those of you, I don't know where you're coming from, but those of you, before we do that, Ross, we've set up just a one question poll to find out who's on the, who are the participants and what organizations you represent, not the names, but the kinds of organizations that you represent. So could you just complete this poll right now? Thank you. All you do is tick it and then submit it. Tick your response and then submit. And Roz, I suspect that you will be giving us the summary as the responses come in.
Yes, we've got lots of, we've got 65% are NGO, international or national.
Okay.
24% university.
Okay.
And 12 other.
Okay.
So we don't have any government at any level and we don't have any donors.
All right, very interesting. So NGOs and university folks dominate. All right, well, we shall move ahead with that. That's helpful for me just as background. So Alan, forgive me, I interrupted your initial talk, so please.
You interrupted my initial cough. So thank you very much, Deb, and good morning, everyone. To many people, economic aspects means program costs, direct and indirect benefits and costs, cost effectiveness, and these are really essential considerations, and Laura will talk about some of these in a couple of minutes. But recently, we've begun to look at full value. This is hearkening back to Deb's comment about economists knowing the price of everything but the value of nothing. And I think in recent years, people have begun to look more at the full value, and this incorporates broader impacts. For example, a child who doesn't have measles because he was vaccinated may have an IQ that's 2 or 3 points higher than if he had suffered measles and survived it. That may translate to greater productivity and greater income over a lifetime. This full value may be difficult to calculate, but it's a very useful consideration and one that's increasingly being used. For example, with respect to campaign integration, we can readily estimate program costs and indirect benefits, such as the dollar value of parents not having to take time off from work for multiple campaigns. These indirect benefits, excuse me, may be greater than the program cost savings of integration, and they certainly need to be incorporated into our analyses. And it seems to me that in many analyses, these benefits to the community are not incorporated as fully as they ought to be. But looking at the full value of integration might entail assessing whether or not having to take off so much time from work for multiple campaigns results not just in dollar savings in wages and salary, but also in greater productivity and improvement of the family's overall economic status. We also need to consider economic incentives and disincentives to integration. For example, funders, policymakers, and program directors might view integration either as an opportunity to share costs and thereby reduce the amount they need to put into things, or as a threat that could dilute achievement of their own objectives. I think that participants in this session, I hope they'll address some of these issues. I heard in one of the sessions yesterday, discussion about how program managers were reluctant to integrate because of concerns about this dilution effect or not being able to fully accomplish their own goals. I hope our general discussion will delve further into these issues and perhaps come up with some specific suggestions as to how we might address them. Thank you, and let me turn over to Laura now.
Thanks, Alan. And thanks, Deb, for that introduction. And thanks to everyone else for joining our discussion today. So as Deb mentioned, my name is Laura Boonstoppel. I'm an economist at ThinkWell, and we've recently developed methodological guidance on how to cost immunization campaigns. And as a part of that project, we've completed a series of campaign costing studies, and 2 of those covered campaigns that co-delivered multiple interventions. So we looked at one campaign in Sierra Leone and one in Nigeria. And so I'm not going to be discussing that research here in detail, but if you want to look at our findings on that, you can find it as poster 1.5 on the meetings platform. And so what I'll be talking about today is rather starting from what we've seen so far from the research that we've conducted. What are some of the gaps that remain in terms of unanswered questions on the economics of co-delivery? And what are some of the challenges that still lie ahead? So from our research, we struggled with a few specific challenges in trying to tease out the precise effect of co-delivery on the cost of delivering campaigns. So we noticed some mixed results when comparing the two countries where we studied the cost of co-delivery. So for example, in one, there were clear financial efficiencies in co-delivering multiple interventions during the campaign compared to areas where they hadn't integrated these interventions, while in the other, this wasn't the case. And so another thing we noticed was that in one country, co-delivery campaigns sometimes seem to have required more human resources for health, whereas in the other, we didn't see this. And so in trying to understand why, we bumped into a few specific limitations that arise when conducting cost evaluations of co-delivery campaigns. So the first is that we're always comparing areas that co-delivered to areas that during that same campaign only delivered a single antigen or a single intervention. And so these areas will have differed from each other in many other ways that also affect their cost profiles. And so you can think of geographical challenges that may make delivery more costly, or security issues, or maybe the target population is more dispersed, or there are fewer HRH available, or lower existing capacity to start from. And so because we're not doing a trend analysis over time, as you could do when looking at a routine program, it's hard to tease out the precise effect from co-delivery on cost. And so this same challenge applies when we then want to go beyond just looking at cost efficiencies and compare the cost to the quality of the integrated campaign. Because what we want to know is, okay, even if we're seeing financial efficiencies, did adding on more vaccines or other interventions to an existing immunization campaign reduce the coverage of any of these interventions compared with a standalone campaign, or maybe it actually helped to increase the coverage of all of these interventions? We just don't know because we don't have a before or after to compare with. And we would then rely on data from previous campaigns that are either conducted much earlier or later campaigns that may have just used different strategies altogether. And so apart from these limitations, there are some questions that our research hasn't looked at all yet that would need answering to. So one is to what Alan was referring to as well, the societal benefits of co-delivery. So this is not something that we've looked at in our study, because we usually assume that the cost of a campaign to beneficiaries, for example, is low, because the whole purpose of organizing a campaign is to bring the services closer to the client, and that if multiple services are co-delivered, this is even better for them because they spend less time queuing, less time of work, less time traveling, and so on. But this is not something that we've actually confirmed in our studies, and so it's something that still needs to be explored further. And linked to those kinds of broader benefits is the gains of co-delivery to the broader system. So we can imagine that pulling health workers away from their day-to-day jobs for only one co-delivered campaign instead of two separate campaigns benefits the continuity of the delivery of other essential health services at primary healthcare centers. But again, we haven't analyzed this yet. And so that's another question that needs answering. And so these are some of the limitations and unanswered questions in evaluating the economics of co-delivery. And so even though it's hard to pinpoint the precise effect from co-delivery on cost, there are a few observations that still hold that do provide us with some guidance. So one is that there's this intuition that we economists would have that economies of scale matter. So delivering greater volume reduces the unit cost of delivery. And this is an effect we usually see when we're costing routine programs, and this seems to hold for campaigns as well. And so it may not matter much whether that's greater volume of the same vaccine or just greater volume because there are more interventions delivered at the same time during campaign. So this is the first point, that delivery volume matters for the financial efficiency of a campaign just as much as it does for any other campaign. And the second is that we may want to be careful in focusing too much on the financial efficiencies only. So greater use of existing resources is something we would see only when looking at the economic cost of delivering a campaign, and this can be an important factor. So if a co-delivery campaign requires greater use of human resource for health, for example, then we cannot just keep adding on interventions indefinitely. And so we need to carefully look at available capacity during the planning stage. And the greater the existing capacity available, the lower the additional financial expenditures required to make co-delivery happen. So if we have enough health workers available, you may not need to hire as many additional volunteers, for example, to make a co-delivery campaign happen. So looking at both the financial and the economic costs is important. So there's certainly plenty more to explore on the evidence generation side of things, but I think that in addition, there are some big policy questions that need to be addressed that go just beyond just calculating the precise cost efficiencies and the precise size of the economic benefits from integrated campaigns. So we need to think through the practical implications for governments as well, and partners and health workers. Because this, and Alan mentioned this as well, in some settings, health workers may be super reliant on the per diems that they receive from regularly conducting campaigns. And if that's going away, what happens to their motivation levels? Are we going to adjust their regular salaries to ensure that they have this regular income? Or at a systems level, what are we going to do with all those savings that we've identified? If there are grants normally support campaigns and these are utilized to invest in infrastructure, how do we ensure that any savings from integration are indeed rechanneled to then invest in routine systems? And so I believe these are some of the questions that we would want to discuss as a group as well. So I'll stop there. Thanks everyone, and handing it back over to you, Deb.
Thank you, Laura. You've posed some very interesting questions and quite complicated ones, and I really do appreciate your insights. We have keyed up, well, I suppose queued up is better, Fiona Fleming to make a couple of comments. She hasn't prepared. We asked her this morning with about 10 minutes, but I know that Fiona always has interesting comments to make. So Fiona, I wonder if you could both react to Alan and Laura's comments and then pose perhaps some additional insights that you have. Thanks for being with us this morning.
No problem, Deb. Thanks. It's a pleasure. And there were so many things which Alan and Laura mentioned. I was like, oh, that's such a good point. That's such a good point. And kind of echoed an experience of a study which I led, which was a wee while ago now. But it was looking at when the neglected tropical diseases were first integrated instead of the standalone programs. And, you know, overall, from a sort of donor perspective, integrating showed that there was a reduction in the cost per treatment because of the economies of scale that Laura mentioned. And ultimately, actually, based on the epidemiological data, there were cost savings of 54 to 72% achieved, but also the DALYs averted were very high, and it was very cost effective in terms of NTD case averted. So, you know, on the top level, great, let's integrate these NTDs, makes sense. There's a lot of overlapping activities. But then down at the level, which you both Alan and Laura mentioned, at the community level, the volunteers who were delivering the drugs, their workload increased substantially, and actually their productivity decreased substantially as well. Their ability to reach the minimal WHO coverage targets actually reduced because they were spending on average about 2.5 weeks unpaid away from their subsistence agriculture activities and other activities where they may have been generating income to volunteer for these programs. They also had decreased motivation and sort of felt undervalued by having multiple interventions added to their workload. And there was obviously variation between across the different packages that were being delivered. But one thing I was thinking as Laura was speaking before she actually mentioned it, was wouldn't it be good if you could those cost savings seen at the programmatic level, how could you then use those within the health system, the rechanneling that Laura mentioned, to strengthen the health system so it wasn't only relying on volunteers, but there was those health workers either at the primary level or even higher that were co-delivering the interventions. And I think another thing that's worth noticing about co-delivery, which really impacted on the study that I led, but also just, sorry, I didn't introduce myself. I work for an NGO called the SEI Foundation based in the UK, and we support the delivery of, well, ministries of health. We provide technical support for their delivery of their programs for largely for schistosomiasis and the soil transmitted helminths, but other NTDs as well. And what we've seen with the ministries when they're trying to integrate their programs is that the timing of the different resources coming in to then co-deliver has a massive impact on when they can do their campaigns. So perhaps they've planned for the campaign to happen in May, but one set of interventions, one set of drugs has arrived, but the other set is now being delayed, and another set has been delayed. And so the campaign, the integrated campaign can't happen until a lot later in the year, and that obviously has some impact as well. And so I think even thinking then beyond and integrating NTDs with other campaigns, it's that timing also is really critical in trying to think about and streamline.
Fiona, thank you so much. And apologies for not introducing you. I thought everybody knew who you were.
I didn't introduce myself either.
No, and I didn't introduce myself either, so that's pretty bad. My name is Deb McFarland. I'm at the Rollins School of Public Health, and the building that you see behind me is our latest building here in the Rollins School of Public Health at Emory University. So thank you for putting up with this very strange background. I'm not quite sure how it got there. I see that there are a number of questions posed or comments, but I'd really like to open this up for conversation and discussion from the participants. And I think what would be helpful is if you have, if any of you have experiences and comments, either positive or negative, about how economics has contributed to discussions in your policy discussions and programmatic decisions that you're making. Because after all, one of the primary reasons we do the work that we do is because we hope that these results actually make a difference in terms of policy decisions, programmatic decisions at either local, country, national, or even global level. So if you have some insights about that and some examples, that would be very helpful, again, either positively or negatively. But I do want to open it up, and I'm going to go ahead. I'm trying to read through very quickly the, excuse me, the comments that people have made. So for those of you who have made comments thus far, AJ, if I may call you that, you actually had a comment in the aftermath of Alan's comments. Could you open up and ask your question or make your comment? They don't have to be questions, but we'd love to hear from you. You may have. Oh, thank you, AJ. Dr. Oteri, thank you.
Right. Yeah, thanks. So what I was saying was that from discussions in the past and even yesterday, we all see the economic benefit of integration, and it's been said over and over again. So, and for integration, part of the things that you have to negotiate. Why don't we use this platform to negotiate with the funders? Because most campaigns are funded or approved by the Gavi, Global Fund, and some other donors. why can't they at that level start preaching integration so that at the country level, they tell them, look, I know you are doing a campaign on measles, yellow fever, and stuff. Try and put them together and let's see how it will work. It requires a lot of extra time to plan, to ensure everything go well. But I think at the end of the day, it will be something that we can be proud of, that they integrated and they did it very well. Thank you.
If I could respond, I believe, in fact, there are discussions underway between Gavi and the Global Fund about that very issue, because this is a real problem. Funds are allocated to Gavi for immunization, and funds are allocated to the Global Fund for malaria. Trying to integrate these is difficult, and I think this is going to be one of the major challenges to integration. I think you're very correct. And I'm hopeful that it can be worked out, but we'll have to see. Over.
Thank you. I wonder if any others of you have comments on that. I mean, it's a question, Dr. Oteri, of walking the walk rather than just talking the talk. So it's one thing to ask for integration and to prompt integration at national levels, for example, in various public health strategies and interventions. But as you say, at the global level, all of these various groups do have their own silos and their own funding structures, which come to the national governments and the national program managers in very particular ways. So I appreciate you raising that issue. Let me turn to Pat.
Hi, thanks. Yeah, just a quick note for the team here who's listening. Please be listening carefully in the plenary session of our leadership team. One of our speakers will be from the Gates Foundation. Unfortunately, our Gavi speaker is actually provided a video, so it won't be available for live questions. But some of our focus in that panel will be precisely on this, AJ, that how can we change the way funding is done to actually facilitate the best result from the country's perspective to get these services provided. And so it should be a very interesting discussion, and I'm looking forward to hearing what those leaders say. So please join in and have specific questions for them.
Thanks, Pat. Could someone put that, what time that is in the plenary session? Put that in the chat for those of us who don't have the agenda pulled up straight away.
Sure, it begins at 10 o'clock. Is that right? It's 9:50 Eastern time.
All right, thank you, Pat. That's very good to know that that is on the agenda. Anyone else who has comments around that particular issue that AJ has raised? Absolutely critical one, and it's good to know that there is a lot of thinking about it from the global level. All right, let me turn, Karen Wilkins has a quote from an implementer when I ask about the cost of the RED strategy, which is the immunization strategy integration, I think, the immunization strategies. And the comment was, it depends on who is paying. Karen, you want to elucidate? Give us some examples.
Well, I don't know that I have many examples, but it's the challenge of measuring that was brought up. I think it was Laura was talking about it. And how do you control for instance, Gavi gives a forfeit of 65 cents per immunized child for malaria. For measles. So it's going to cost at least that. It also depends, I think, on who is implementing it. Some NGOs have a lot more overhead and some have fewer. So it's a challenge in measuring. But also to step back to something else that Laura said, that you have to sometimes step back for the larger picture, that the campaigns, they're good for increasing coverage of your various interventions, but they are also, you have people working for free between campaigns, village health workers, et cetera, who are working very hard all year long for free because they know that a campaign is coming. And if we start integrating campaigns and have fewer of those opportunities for those volunteers or people who are underpaid, then we might have a demotivating effect of the integration. So perhaps it's not always the best option. Over.
Thank you, Karen. Certainly, Laura mentioned that, and also Fiona, and comments from others. I too have been thinking about that a lot, and I'm sure many of you have been working with various strategies do as well. The foundation of much of what we do, the key resource of much of what is done in countries and communities is by community health workers who are volunteers. And the notion of volunteerism is one that I don't think that we have really teased out very well. And understanding, we have looked at, many of us have looked at the various motivations that lead people to volunteer. I mean, these are remarkable people who do this work, as Karen says, over the course of the year, paid very little, and yet, or if at all, and often reliant upon the incentives or the per diems or the motivations, whatever it is that various NGOs and others bring to strategies, immunization strategies, NTD strategies, malaria campaigns, et cetera. How long can we rely upon these volunteers to be volunteers? How do we incorporate them, or do we incorporate them into the formal workforce? That's a big discussion, as all of you know. But the notion of volunteerism, and in some ways professional volunteerism, is one that I don't think economists have addressed very well, and it clearly comes up in the context of integration. So other comments? I don't want to dominate the discussion, so I'm just posing questions. I see Pat's hand. I'm not sure. Let me go to gallery view and see if there are others. Pat?
Patrick, right.
Yeah, I'm just kind of expanding on what you said, Deb, but I'd really be interested in what other people think. In particular,
Me too.
I feel like one thing that's happened also that we haven't factored in is we can ask about how to do funding and economics more intelligently and more appropriately to build health systems, thinking of all our campaigns as steady state. With the COVID-19 pandemic, there's a massive demand now to deliver health services and reach human souls at an order of magnitude higher than we normally do through our routine systems. And so we simply can't rely on small marginal increases in efficiency with, by co-delivering here and there. It seems like we really need to think really hard about how we're going to ramp up our ability to reach all these folks with COVID vaccine. And then also at the same time, take advantage of that opportunity to do, while doing that and while reaching these human souls, to deliver anything else we can at the time because of the enormous increased burden we have in trying to reach all of these people with life-saving interventions. I'd be interested in anyone's ideas about how they're doing that or how they've heard that's being done.
Thank you, Pat. Tabuti, thank you.
Yes, can you hear me?
Yes, we
Hello?
can. Thank you.
Yes.
Okay, very good. Now, just quickly, I'm a health economist by training, but I worked for UNICEF for more than 20 years, and I have some experience with these issues of immunization campaigns, and it seems to me that there is enough knowledge on the economics of immunization. There's a lot of literature on the subject. But what's really missing is some greater knowledge on the economics of campaign integration and what drives that. So there are some attempts, as has been explained earlier by Laura, others, but it seems to me that the issue of incentives, which is at the heart of which is driving behaviors at the country level, especially program managers, national decision makers, to integrate or not integrate campaigns, for example, or certain aspect or part of campaigns that can be easily integrated, but yet we see reluctance on doing that. And one would wonder what is driving bad behavior. Why campaigns that can be integrated or certain aspects of them are not done, and for what reason? And it seems that part of the explanation might be related to the funding. How funding is designed globally, provide incentives for countries to maximize the amount of money they get from donors. And in order to maximize that amount of money to get from donors, they have to keep those silos separately so that they can benefit from that funding. But on the other side, the donors are talking about integration more frequently these recent years than before, and encouraging countries to do integration, but it's not really happening. I review proposals, for example, from countries, and I see very little attempts from countries really to integrate campaigns or to integrate aspects of campaigns. And that's why I was wondering why is it so? And that's partly the reason why I joined this session, to see if there is some new knowledge on this. But it seems to me that the funding, how funding is designed, is one area that needs to be explored further. I think the Gavi Global Fund can find ways to change the incentive structure to countries to encourage more integration. Currently, that's not the case. The way funding is done today does not encourage that. So I'll stop here. Thank you.
Thank you, Tabuti. May I make a request, please, that when you speak, if you could put on your video, that would be very helpful. And Tabuti, thanks for your comments. It would have been to see your face. Other follow-up questions? Thanks again, Dr. Tabuti.
Yeah, here.
Good to see you. Thank you. I'm interested in those. I mean, clearly we have the issue of incentives and competing incentives, and very often it's the local health workers, the district health office, the district medical officer, the health team that gets caught in the middle. They get all of these pressures from global and national level, and then demands, as appropriately so, from communities. And they're very much caught in the middle. And the competing incentives that each of the players have, I think, is one that we have probably diagrammed, but not fully understood in terms of how that plays into policy and programmatic decisions. Again, I don't want to dominate the discussion here. So let me turn to others who may have comments or other issues that we want to make sure that those who are doing these types of economic analyses or programmatic analyses, evaluations, take into account. But if you have specific examples, again, of work that you've done that has incorporated issues of economics into both your study, the programs that you do, and your evaluations and results, we'd love to hear those. Eva?
Yes, thank you, Deb. I just wanted to point out, I saw a comment in the chat from Dr. Alan Brooks, one of our, who's leading one of the projects we're supporting. And earlier, I also saw a thumbs up from Gladys Muhire, who was one of our facilitators about the integration session yesterday. So I wanted just to invite our colleagues to speak up if they want to with the few minutes we have left. Thank you.
Yeah, thanks. Alan, or I'm afraid I'm struggling with moderating the chat box and looking at the hands raised. So let me just go in the order in which they're appearing. Carol, you have a comment to make or help me out?
I was just going to help you out. I saw Ine's hand next and then Fiona's. So maybe we can go to Ine and then to Fiona and see what happens next.
All right, Ine, thank you.
Okay, good day, everyone. Can you hear me, please?
Yes.
Okay, so I would just like to say vaccine hesitancy among target populations that we plan for could be another reason for the hesitancy of agreeing to have an integrated campaign. Imagine trying to convince someone who is not, who does not want to give his child vaccination, just one. Then you integrate and you expect that person to give the child 3 vaccines at the same time. So that can be problematic too. Economic aspect might come in as like the second to the last speaker spoke, but I think one of the reasons people hesitate about integration could be vaccine hesitancy. Thank you. Over.
Thank you, Ine. It's an important comment, as you say. The whole issue of vaccine hesitancy is one that probably, which plays in again to incentives that each of the individuals, groups that have a role to play in integration at household level all the way through global level. We have to understand those incentives and behaviors. I think Fiona, you were next, and then Alan.
I just wanted to make a sort of quick comment around your original question, Deb, which was, you know, how much does economics contribute to policy programs and research questions? And I would say, and I'm speaking very much again within the NTD sphere because it's what I know more about, is that it has in the past. There seems to have been a dipping off over the last few years and maybe less funding available for doing economic evaluations around integration with other campaigns. And so I would say that from the donor's perspective, it's very important that they understand the impact that they're getting from their investments, but there doesn't always seem to be then funding available to do the research to support that investing. So it was just a quick comment on that. Thanks.
Thanks, Fiona. I think we'll hold that and come and let others think about how, if you have examples of how economic evaluations, economic issues have been incorporated into policy and programmatic decision-making, that would be very helpful. Alan, may I ask you to turn on your video? Thank you.
Yeah, hi everyone. Alan Brooks, managing partner and co-founder of Bridges to Development. I'm very pleased to be one of the recipients of the campaign effectiveness funds. Firstly, really pleased that the impact of campaigns and the understanding of their impact, starting right from the level of households and communities. Really glad to hear that coming through, because it's just so easy for people to look at it from a monetary perspective, financial perspective, as opposed to really understanding the full breadth of the scope. Because in fact, bringing separate campaigns is a cost, is a disservice, and in a sense is a disrespect for communities. And so I think I'm really glad that's come through clearly here. My question is one that I think is something else that is in my mind, and I've heard some discussion, but I'm yet to see really good data on, which is the value of targeting campaigns, and particularly on a subnational level. It makes intuitive sense, but I haven't actually seen the write-up on this in terms of if epidemiology can't be used because the data is too soft. Are there other ways to target, for example, other criteria variables that could be used to define where the optimal narrowing or focusing of a campaign would be, aside from just saying, oh, we have to do it everywhere, just because it's everywhere. So I'd love to hear thoughts or reflections on that. Thank you.
Thank you, Dr. Hinman. Alan. I'm not ignoring your question, Alan Brooks.
No, well, I wanted
put it
to
in
respond.
The chat, and go ahead, Alan Hinman. Thank you.
I wanted to respond a little bit to what Alan was saying. And in fact, in many situations, campaigns are targeted at the subnational level. I think specifically of cholera, in which cholera vaccine is administered in campaigns in defined hotspots, which are almost always subnational and may be, in fact, transnational or binational in border areas. It's also the case that polio campaigns are carried out in subnational levels. So there is experience. I don't know how much economic analysis has been done.
Thanks, Alan Hinman. Other comments from others in the group about this particular issue, and whether you're aware of any studies that have been published or any in the gray literature that would help us to think about the, excuse me, the question that Alan Brooks has posed. Have field studies or modeling shown that subnationally targeted campaigns are a more cost-effective strategy than national campaigns? Can anyone point to resources or publications? Laura Bonestapel, is that something that your group has considered? Think Well?
We have not looked into that. And I think in assessing that, you would run into many of the constraints I mentioned before, right? Like, how would we compare a nationally targeted to another subnationally targeted campaign if none of the other factors are held constant? So I think that's another challenge. Another question that comes to mind when thinking through that is, again, the question of incentives, right? I think oftentimes campaigns are organized nationally to kind of provide health workers with equal incentives to rolling out campaigns. Prioritizing campaigns subnationally runs into the same issues as we talked about before. When we're integrating, when we're dropping some incentive structures, what happens to health worker motivations? What happens to program financing? Other questions to think about.
Yeah, I kind of put you on the spot there, Laura, but thank you for that. David Gittleman, you had a question and also a comment that, and I'd love to have your comments on what you put in the chat and to carry it further, perhaps.
There I am. Yeah, it was actually, the first one was really a question, because and maybe Alan Hinman and others would know this. I know that WHO EPI is going to be soon putting out a resource on integration of EPI programs. And I'm just wondering, going back to this issue of economic incentives and volunteers, whether in fact they are focusing that document only on the programmatic aspects of doing this, or on the incentive factors. And I know it's taking them a long time to do it. I'm wondering if maybe issues like this are kind of pulling them back on developing and putting those out. I'm not quite clear on the malaria side. Global Fund is open, I understand, to the idea of proposals for integration, but I don't know whether the economic aspects like this and incentive issues are being addressed, and maybe that's one of the reasons that they are a little bit hesitant at this point to open up in it. But I need to learn more about that as well. So maybe Alan, others could respond to that one.
I don't know.
Okay, I got my answer.
That's a short answer, David Gittleman. But as you hear about that information, and as that information is released about WHO EPI, it will be interesting if you have reviewed any of the documents to see if the issue of incentives at all levels has actually been addressed in any specific way, or mostly in a rhetorical way, which is very often.
I see that Natasha Crowcroft is on the line, and she is from WHO. Perhaps she can speak to the integration manual. She also had a comment.
Sure, I can't speak to the integration manual in that I'm not involved directly in producing it, but I know it's in the process of being produced, so I can't tell you what it contains about incentives, but I am very happy to take that comment back to the team that is working on it, if that would be helpful.
Okay.
I also I made a comment about the level of evidence, because it's something we're looking into at the moment, trying to summarize what evidence exists and look for new sources of evidence. And it's something obviously the Health Campaign Effectiveness Group has been looking at as well. So I just feel there is a kind of mismatch between what people say in terms of the narrative around integration and about how we should be doing subnational campaigns, and we should be doing selective campaigns, and we should be integrating, and this is all seen as a good thing, which are all major complex interventions that are being proposed without a good evidence base. So we're developing, we've been tasked at WHO with developing guidance on specifically subnational and selective SIAs, and that has been going very slowly because WHO's role is to synthesize evidence and produce evidence-based guidelines. And if we haven't got a body of evidence to work from, then it's very hard to produce recommendations in the way that we normally would. So I'm not saying I have a view on what the right answer is to this. I'm just saying that in any other area of public health, we would need a body of evidence in order to make a recommendation on how to move forward. Hopefully that's helpful. Thanks. Over.
Yes, thank you, Natasha. That's very helpful and a critical comment for all of us working in this area. Again, integration has been one of those words that has consumed a lot of discussion, but probably a lot of work specifically looking at incentives or any of the other issues around integration. As you say, evidence is weak on a lot of the issues that Laura and Alan and others of you have raised over time. That's what HCA is all about. And I hope that HCA can really play a strong role in pulling together that evidence that exists, and through the research studies at the local and regional level that it has funded, to produce that evidence, so that when, Natasha, you're turning to the core of evidence and you see that it's that high, that perhaps after the results of the studies that HCA has funded and others, that there will be a growing body of evidence. That's the goal, I think.
I wonder if we might want to invite Gladys to make a comment.
Yeah, yeah, I was just, you anticipated my, thank you, Carol. Gladys, are you still online?
Yes, thank you.
Thank you, Gladys.
Thank you. My question is related to the fact that when we talk about campaign integration, even the case study and the implementation research that have been supported by the coalition was mostly related to identify evidence of best practice for campaign integration, but to see the collaborative planning process to identify the best practice for everyone. But as a follow-up to the question that was raised when I joined the call about the fact that the donors should also try to design their funding in a way that will really facilitate the integration. I also think that we should try to have more evidence on the governance structure that we have in countries where we have seen successful integrated campaign. Because I have the chance to have seen different countries organizing integrated campaign, but I can testify that it was due to the Ministry of Health structure, how they are organized, if they have entities in place that really facilitate that collaboration, it was much more easier. So my comment was to really suggest on exploring that component of governance. And of course, it's linked to those incentives and it's linked to health economics to really explore and try to come up with evidence on the best and the more efficient way of organizing the Ministry of Health to better support integration of mass campaign. Thank you.
Thank you, Gladys. That's an important point. Could you give us an example of, or perhaps the observations that you made about countries that, a country that had success in integration? It's always good to hear positive evidence, and you suggested that you had at least one, that you visited other countries.
Yeah, no, I didn't want to go in details because it can be considered as a free assumption. So it's the fact that sometimes, for example, we know that there is some Ministry of Health who has all the vertical program reporting to one entity, while others, they are not even combined in one program. I was referring to those kind of structure in the Ministry of Health. I hope that is clear.
It is. Thank you very much. An important one, and a note that we will make. And we certainly will have notes from this meeting, that's for sure. We've raised an extraordinary number of questions, very difficult ones in many ways to address. David, I see that you have your hand up. Does someone else, Carol? I'm sorry, I don't have the full screen.
There wasn't another hand up, but I wonder if after David's comment, we might want to invite Ing Libon to make invite him into the conversation. I've seen a few comments in the chat.
Okay, thank you, Carol.
Yes, hi, this is just a quick question. Thank you very much, Gladys, for your comments. My internet is extremely stable, so I think I got about 2/3 of it. I just wanted to know about the whole issue of government structures for this, which is extremely important for integration. I don't know of them, but how many of these structures for integration have actually invited a Ministry of Finance into the actual discussion right at the start of how this sort of integration will be doing, and whether in fact, if you're talking about government structures, perhaps at this point, right from the beginning, coordination committees and so forth need to have a representative of the finance Ministry of Finance to be able to ask these pertinent questions. I don't have an answer of it, so I'm raising it to the floor.
Again, an important question. If any of you have any observations or have participated in sessions, meetings, conversations, policy deliberations that have included the Ministry of Health, Ministry of Finance, that would be helpful. I know I have, but I'm going to turn to Ing and ask you to make your contribution. You had a question in the chat, and perhaps you want to restate that question and then follow up on anything else you'd like to comment on. Thank you, Ing. Seems that Ing is either struggling with internet or has stepped out. Perhaps we can come back to her. Yves Bazant, you've asked the question, what could the HCE coalition do in the coming year to advance this topic and address the topics and the questions that we have raised during this hour discussion? I think we've got a whole long list of questions, Eva. Now could you tell us what you're thinking about at the coalition and how we might, those of us on this call might contribute to those discussions at HCA?
Right. Well, it was, and I see a couple of hands, so I don't want to take time away from folks who had a point to respond to what you just said. It was what I put out there was more food for thought, because we are coming into our third year of this award that we have. It's a 3-year award. So trying to refine our work plan priorities. We have very limited funds for new research, but we are collecting thoughts and ideas that can help shape any directions we may take, but also we would be happy to leverage with other sponsors and other efforts going on by the Gates Foundation and others. So of course, we are also in the business of promoting dialogue, which we're doing today, and we have some ability to continue dialogue in the future. So it was more of a rhetorical question of like, if there are specific gaps or opportunities, you can always reach out to us at HCE Coalition or myself. We're struggling to try to define like if there's any investment we can make related to this economic financial aspect. I know some of the groups that we're sponsoring are coming up with interventions, and so are eager to look at not only effectiveness, but cost effectiveness. So we're very interested in sort of some of the costing guidance that ThinkWell has made available. And so it was more of a rhetorical question, and I'm interested in others' thoughts. But we have a couple hands, so I'll
exactly.
Thank you.
We've got a couple of hands, and Ing, you seem to be back on, and we'd love to hear your comments. And then Tabuti, and then I'm going to have to call us to conclusion because I know we only have a couple more minutes. So Ing, please. Tabuti, while we're waiting to see if Ing can join us, could you make your contribution, please? Dr. Tabuti, you're muted.
Yeah, sorry about that. I will just go back to a question raised by the David Gittleman regarding country level structures and to what extent they encourage or discourage integration. And it seems to me that the way programs are organized at country level with vertical setups, even within the immunization program itself, you can find different sub-programs organized quite vertically with different dedicated teams and logistics. And one would wonder to what extent this setup, organizational setup, institutional setup at country level is playing a key role in encouraging or discouraging integration, even within the immunization program itself. And I was wondering whether there is any research, any evidence on that.
Well, thank you. We've got a whole set of questions for which we need evidence. So I hope that we're keeping track of all of these questions. I'm going to turn to Ing one last time. Thank you, Tabuti, to see if she can contribute. Oops. Oh, Ing, thank you. Are you joining us? Sorry. Ing, you're muted. Could you, it's good to have you, please. Thank you.
Yes, my name is Liban Adam, and I'm the director of Within Relief Organization. WARO is, I'm the director of WARO. WARO is based in Somalia, especially southern Somalia. And after that introduction, I want to ask one question, one very important question, and it's based in malaria. As you know, malaria is one of the coalition's main agendas to eradicate. And we know that in Somalia, and we see that the strategic plan to eradicate malaria is not highly encouraged. So in your contribution, what are the main suggestions? Thank you.
I'm not sure, Ing, that I got the full essence of your question. I think you were talking about the obstacles to eradication of malaria in Somalia. And perhaps we turn the question back to you, the challenges that you might face in integrating other public health strategies or public health interventions into malaria campaigns. Unfortunately, we don't have time to pursue that. We're going to have to cut off the discussion. I wish we could continue on. I hope that those of you who have participated thus far will continue to dialogue with both HCE, WHO, ministries of health, donors on the whole issue of integration. All the questions and comments, this session has been recorded, but Patricia is indeed keeping track of all the questions and comments so that we have a running list. We have a research agenda for many of us for the remainder of our lives. If we could come up with strategies and studies and funds to do the kinds of work that is needed. Many thanks for the contributions from all of you. We will have a lot of follow-up, and I hope that this has been at least in some ways provocative and got you thinking about issues that perhaps you haven't thought about before and ways that we can move the agenda forward of economic aspects of integration. Thanks again to all of you. Enjoy the rest of the sessions.
Thank you very much, Debs, and thank you to Alan and Laura and everyone who's contributed today. It has been our pleasure to support you as MYT today. We will take a short break, and if you could join us back at 9:20 EDT on the main stage for our closing plenary on the promise of collaborative action, followed by panel discussion with perspectives from the HCE leadership team. For the homepage, if you go back to the homepage on the main stage to join the meetings tab, look forward to seeing you after the break. And thank you very much again to all our speakers and everyone who's joined us today. Thank you very much. We will now close the session.